Hello, and welcome to our clinic. We know you're here because of a painful problem or physical challenge that needs attention. We are here to help you get better as quickly as possible. With that in mind, we would like to take the next few minutes to help you understand your problem better. Your doctor will be happy to answer any specific questions you might have after we're done.
First, we have some good news for you. Over 90% of our patients have been able to achieve good to excellent outcomes when following our care recommendations. We will help you to recover as quickly as possible. Most patients will usually notice significant improvement within 2 to 4 visits. We will continue with treatment as long as you continue to make progress with your recovery. If your condition does not respond to care in our office, we will refer you on for another opinion.
Our approach to treatment will usually provide relief from one or more of the following problems: pain from stiff or restricted joints, including joint injury and or osteoarthritis; pain from muscle tension or injury, which can be caused by stress, work, sports or motor vehicle injury, and even simple overuse; pain from nerves which can be pinched by a bulging disc, a tight muscle or ligament, or from injury to the nerve itself; pain from damage or injury to a disc. An injured disc can produce pain all by itself, similar to the pain from a sprained ankle, without actually trapping or pinching a nerve. And finally, pain caused by muscle weakness. Similar to problems caused by muscle or joint stiffness, weak muscles can also be a source of pain, usually from your body's attempts to compensate elsewhere.
Normal, healthy movement of all of the joints of the body, and especially of the spine, depends upon each individual joint performing its normal amount of work. Pain commonly results when one or more joints lose this ability as a result of injury, overuse, or lack of exercise. This loss of movement is demonstrated by the yellow arrow, which is pointing to 2 locked vertebrae in the middle lumbar spine. This loss of movement will eventually force the body to compensate with an increase in movement at neighboring joints and muscles. This is demonstrated by the red arrow, which is pointing to increased movement at lower lumbar levels. Even though your body will do its best to maintain its overall flexibility, the joints and muscles that are forced to compensate will eventually begin to fail from the extra work, making it easy for weakness, wear and tear, and even injury to develop. Manipulation is an important method used to restore normal joint movement at the levels where it has been lost, again illustrated by the yellow arrow. As a result, spinal manipulation is often an important part of treatment for bulging discs and to relieve pressure on irritated spinal nerves, shown here at the level of the red arrow, as well as for painful joints.
We often think of a pinched nerve as being caused by a bulging disc, but in fact, stiffened or scarred muscle tissue caused by injury or overuse can cause this problem as well by creating pressure on nearby nerves. Clinically, we refer to this as muscle fibrosis or adhesions. This slide shows the back of the pelvic girdle and buttock muscles of the right hip. As an example, the piriformis muscle, indicated by the arrow, can be irritated by a fall on the buttock or by sitting for too long a period of time on an uncomfortable surface. The sciatic nerve, which runs down the back of the hip and thigh, runs directly next to the piriformis muscle as it leaves the pelvis. Adhesions in the piriformis can cause pressure on the sciatic nerve, resulting in sharp pain traveling down the thigh and often to the calf and foot. Fortunately, this type of pain is often relieved by proper soft tissue therapy of the involved muscle. Soft tissue therapy, designed to break down the adhesions in the muscle, is an important part of our treatment. All of our doctors are trained and certified in active release technique, a particularly effective form of soft tissue treatment. Additionally, for some nerve entrapments located in the hands and feet, we may also use Graston technique instruments to relieve symptoms related to carpal tunnel or plantar fasciitis.
Well, Those are the basics, and thanks for listening. Your doctor will be in shortly to discuss the specifics of your case and to answer any questions you might have about your care.